The Seattle Times reporting 56 children who had recent contact with Child Protective Services died or nearly died after ingesting deadly drugs. Out of those 56, 23 involved children under the age of 4 and 18 involved children under the age of 2. Well, this troubling trend does not end in Washington state. Since 2015, there's been a 52% increase in child opioid-related deaths all across the nation. Let's bring in Patrick Dowd. Patrick is an attorney and the director at the Washington State Office of Children and Family Services. Patrick, thank you so much for your time on this. So disturbing. How and why is this happening to so many children in the state child welfare system?
Well, I think we're at a confluence, both in Washington state and nationally, in a trend within the child welfare system to preserve families and to end a practice of, frankly, in some cases, needlessly removing children from parents' care. And there's a lot of research that shows that children do much better when they remain in the home, in parental care. So we have that movement within the child welfare system at large, and then the confluence of the fentanyl crisis within our communities. And I think our child welfare system is really struggling to reconcile both laudable goal of keeping children in the home and preserving families, along with ensuring child safety and dealing with the tragic influx of fentanyl affecting our communities.
Absolutely. Well, speaking of that influx, let's listen to what AG Merrick Garland had to say during a press conference on this latest crackdown, those arrests announced today.
We are here today to deliver a message on behalf of the United States government. We know who is responsible for poisoning the American people with fentanyl. We know who is responsible for shattering families and communities across the United States with drug poisonings and overdoses. We know that behind the deaths of hundreds of thousands of Americans is a cartel-driven fentanyl trafficking network that spans countries and continents. We know that this network includes the cartel's leaders, their drug traffickers, their money launderers, their clandestine lab operators, their security forces, their weapons suppliers, and their chemical suppliers. And we know that this global fentanyl supply chain, which ends with the deaths of Americans, often starts with chemical companies in China.
All right. So Patrick, I mean, what is the solution here? Is this about, better and more training? We see these arrests, but at the end of the day, if the drugs are in the hands of these people, is it about more random drug testing? Because of course, in so many of these cases, we're talking about kids who cannot protect themselves.
Well, as pointed out in that clip, the root cause is preventing fentanyl from entering our nation and our communities in the first place. As far as the frontline child welfare workers, what they need is the resources to engage families. I think there's a need for improved training for the child welfare workforce, as well as the parents and service providers involved with the families. There is a need to expand substance use disorder assessment and treatment resources, certainly in Washington state, and I assume throughout the country. And there are also just tools that can be made more available to the child welfare workforce, including providing naloxone for families, lock boxes for drugs that are present in the home, providing fentanyl testing strips to parents and professionals that are involved with these families. But again, those steps are not addressing the root cause, which ultimately is preventing fentanyl from entering our communities.
Absolutely. Yeah, we certainly have to cut out that root cause here. Patrick, before we let you go, do you think this is going to get worse before it gets better?
That's a hard question to answer. I try to be optimistic, but I don't see anything immediately on the horizon that would indicate that the presence of fentanyl will suddenly decrease or that the risk to children will be alleviated.
Yeah, and this is such an important topic to stay on. Obviously, talking about the most vulnerable Americans, our children. Patrick Dowd, thank you so much for your time.
Thank you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.